Hi, my name is Karen, and I was first officially diagnosed with COPD in 2001, and also with hypertension, although I had both of them for several years beforehand. But officially, COPD in 2001 and hypertension for probably several years prior to that as well. You know, living with both of these conditions is challenging. Hypertension is something that really doesn't have very many outward symptoms. I have a wrist cuff, and there are times that I do notice that my blood pressure has gone quite high. I'm on medication for it. My cardiologist has told me to watch my blood pressure, and if it gets above a certain number, to double up on my blood pressure meds, and then to keep an eye to test again. If it doesn't come down, to contact them. So far, I've been fortunate it does come down. But you know, with COPD, I'm on oxygen for exertion. So, sometimes when I get into my PCP's office after walking from her parking lot, even using oxygen, my blood pressure will be quite high. But it's only temporary. I have to tell them, wait, don't take my blood pressure right away, or take it again. Because as I sit and calm down, it will go down. So it's a matter of knowing when it's dangerous, when it's temporary. Sometimes when I get up in the morning, it will spike. But I also have another condition that can cause me to have problems. I have hydrocephalus, the adult version. So all of these things together can be difficult to determine. Is it the COPD that's causing the shortness of breath? Is it the COPD that's causing maybe a little bit of high blood pressure? Is it the hydrocephalus? Is it the hypertension? You have to come to know your body. And you have to be really honest with your physicians. And they have to know you. And it takes time. And it takes being honest. My advice for living well is, no matter what condition you have, is to learn everything you can about it, follow your doctor's advice, be part of support groups where people can share with you the tips and tricks that they have learned for dealing well with whatever adversities they have in their lives. A lot of us have problems. Don't dwell on what you can't do anymore. Think about what you're still able to do. Yeah, I'm 79. I can't run a marathon anymore, although I do know of at least one person who has COPD and still runs marathons, but I can't. But I can still travel. I can visit my friends, my grandchildren, my great-grandchildren. I can still be an advocate for others. I don't dwell on what I can't do. I enjoy what I can do. And one of the things that is so important to me is to give support to others, to help them realize that having COPD and comorbidities such as hypertension or heart diseases of any sort doesn't mean your life is over. you can still reach out to others. You still have the chance, the opportunity to live a good, successful, wonderful life. It's not over. Staying on top of my health care is extremely important. The older I get, the more important I realize it is. It's extremely important with COPD, and it is with heart conditions, hypertension, and really with everything. One thing I do is to make sure that my primary care physician has got copies of everything that my specialists have done, all the tests, all the visits, because even though they all accept my insurance, they're not all under the same health care umbrella, so to speak. So she doesn't always get records of their tests. So, for example, today I saw her and I brought to her the latest test results from a couple of the specialists I have seen, and she was glad to get them. This way, she always has everything from every physician I have seen. I've learned not to wait, especially with COPD. You don't wait. The Foundation's COPD action plan is fantastic. I've also learned with hypertension that I need to check my blood pressure regularly. I used to be kind of hop, skip, and jump with that. Not anymore. I check it on a regular basis because there have been a couple of times that my blood pressure has skyrocketed, and I have had to double up on my meds and go see my cardiologist. And he has run some tests, and fortunately, there's been nothing majorly wrong. But when you get to a certain age, things can start to go wrong. So it's very important to keep all the doctors, the primary care, and all the specialists on the same page. And that's how I manage my health care. That's my priority, is that everybody knows what's going on. The COPD Foundation, the 360 social media section of that, is extremely supportive of everybody, whether you're a new patient who's just found it, or whether you're somebody like me who's been a member ever since day one. We welcome the new patients, we support them, we try to help them be not quite so scared, if at all possible. We direct them to good educational materials. And then those of us who are longtime COPD patients, we support each other too, because there are times when we are feeling a little bit down in the dumps. We're a little worried about something that's come up in our lives. And everybody supports everybody else. The patients, the staff, the clinicians. It's just an absolutely wonderful group. And everybody there does, well, if you're a patient or a caregiver, you're there, and some people have comorbidities, some don't. But it doesn't matter. Everybody supports everybody else.